Yeah, it's interesting as well that you mentioned this idea of helping people to not go back to coping mechanisms, because addiction or substance use issues is the other major thing it seems that these infusion clinics are using ketamine for. And we mentioned Gabor Mate at the start, and he's done wonderful work explaining how it makes more sense to view addiction as a kind of coping mechanism for emotional pain, as a way to kind of soothe that, right? And instead of viewing it as just some kind of chemical hook issue. And in your own work, have you, I guess, what kinds of things have you used ketamine with people? Does it include kind of depression and addiction and any other issues?
Yeah, so indications have been addiction, OCD, trauma, anxiety, depression. Did I say depression? Because if I didn't, I meant to say depression as well. Yeah, but those are the main indications. And to me, indications do matter. Because the way symptoms present in a dosing session with depression look a little different than the way symptoms present in a dosing session with PTSD. I find that PTSD is a little bit more intense than the depression sessions, but nonetheless, it's all for me fundamentally about finding the patterns that folks tend to just be kind of stuck in, and helping them to, first of all, be aware of what's happening, so that they can have the agency to intervene. Because we can talk about it up here all day, but it's really registering it in that heart space, and that kind of emotive space that, in my experience, really produces that change.
Yeah, I like that idea there of kind of, I guess, treating each person like a person who wants to do the work on themselves, rather than as, mainstream medicine might say, well, here's a person with addiction, and we're going to say they have some particular brain disorder, and here's a person with depression. And instead of saying, well, maybe the person with addiction is responding to a trauma, which is making, they could have had a trauma that's making them depressed, and then the emotional pain is being soothed by the addiction. And then you realize the best thing is, I guess, just to treat everyone like a human who's trying to overcome suffering.
Exactly. Gabor Mate has this phrase that resonates with me deeply about addiction. It's not why the addiction, but why the pain. So really trying to figure out where's the pain stemming from, these behaviors stemming from. And I think that that's one of the fallacies of Western medicine, is that even in the psychedelic medicine field, that we tend to pathologize a lot of things, that I believe, some things don't need to be pathologized, because when we become obsessed with the pathology, I think we dehumanize people in the process. And once they become this, we're trying to change the symptoms and reduce the symptoms, that is a dangerous place to be, because you really are reducing the person, the experience, to molecules, chemicals, and that, I think in theory that can be a way to conceptualize what happens, but in practice, we're humans, and humans don't just have this linear life. We can plan for things to go a particular way, but life tends to give us curveballs to make it more interesting. And it's up to really figure out how to find our dance, and find our movement in the space, which, for some folks that can be easy because they have access to the resources, access to the space to be able to be free. But for other folks, they don't have that same access, and it can be a bit more challenging to find that movement.
Right. Yeah, I think also on the point of this, I guess, reductive way of seeing things, I've seen a few people kind of confused by the use of ketamine for something like, if someone's presenting with alcohol addiction, I've had people say, well, I've seen people doing ketamine recreationally and drinking alcohol to, an extreme in clubs day after day. And then there's this kind of bafflement as to, well, how could that be a treatment for addiction? But I guess, would you say that, the therapeutic container and all the work people are doing is an entirely different thing, right, to just going out and taking a chemical?
Gosh, I'm so glad you bring up this point, because that I've been trying to find a way to talk about this piece. Um, and so there's a couple parts for me that I want to talk about here. So, yes, um, it's not just about the medicines, right? It's really about the context or the setting that the medicines are in that really create a container for what you want. Which, we there's always talk in the medicine field of the mindset that you have going into an experience, the setting that you have the experience in, um, that all of these play a critical role in the type of experience that you have. So, yes, taking MDMA in a clinical setting, where you're getting 99.9% pure MDMA, is absolutely going to be different than taking MDMA in a more recreational setting, where you might have street MDMA, which might have MDMA, but also might have other psychoactive substances in it. So unless you're testing your drug, you don't know exactly what it is you're getting. So those two contexts are very different. However, this is not to say that healing can't also happen in recreational settings. I've heard from friends, and have experienced myself the power that these medicines can have in recreational settings. And I think that we continue to talk about accessibility, it's for me, that conversation is not just limited to the medical settings and the financial aspects of and the cultural aspects of making psychedelic-assisted therapy accessible for those who need it. Because the reality is, there are going to be some folks who want to engage in medicine work in that medicalized setting, because that's, where, church is, and it's efficacious, it's safe, et cetera, et cetera. But the reality is that there are also going to be some people who want to do medicine work, but don't want to engage in that work in the medicalized setting, because it's not safe historically for Black folks in particular, that, Western medicine isn't, often the safest place for Black folks to be healed. And so there are going to be some folks who want to have a different container. And I believe it's important, as we talk about accessibility, to also talk about folks who are going to be doing these substances on their own. And the reality is, it's already happening, where folks are hearing about this medicine work through, the main, through books, through media, and they're microdosing psilocybin on their own, or they're taking amine, they're taking LSD, they're taking MDMA on their own, and then are wanting to come to therapy to help integrate those experiences. So yeah, it's just important to name that we need to continue to be mindful about creating the containers for folks to have safe and to have education around these substances, and the power that they can have, whether it's in a recreational setting or it's in a medical setting.